To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, it's October, which means it's Breast Cancer Awareness Month. To help us with that, we are joined by Dr. Fernando, radiation oncologist from ThedaCare Cancer Center. Hi, doctor.
Hello, thank you for letting me join and speak to your audience today.
Well, absolutely, and we mentioned it is Breast Cancer Awareness Month, so let's just jump right into it. What are some potential warning signs that women should look for breast cancer, and why is it so important for women to kind of know their bodies?
Yes, one of the most common symptoms could be a breast mass that is new. There can also be such things like skin changes. There can be changes in the nipple or discharge from the nipple. But it's also important to remember that some breast cancers actually don't have any warning symptoms or signs. And that is why it is so important for women to understand their risk and pursue mammograms.
And I think that's the key, is when you don't notice something, is to get those regular mammograms. Have there been any changes in the recommendation for screenings or guidelines for screenings?
Yes, there are different societies that have slightly different guidelines. Most of us do follow the American Cancer Society guidelines, which recommend that women start screening mammograms at age 40 and continue annually. Once they get into their mid-50s, there may be an option for low or average risk women to have mammograms every other year, but oftentimes we continue those annual mammograms as long as the patient is well and doesn't have a lot of other health issues.
Right. Also thinking about family history, are there things that women can do preventatively if they know they have that family history?
Yes, it's just really important to know one's family history, especially as we are learning the genetics of breast cancer, that there are certainly genes tied into a higher breast cancer risk. And although you can't change genetics, there are many lifestyle things that you can have an influence on, including living a healthy, active lifestyle, including balanced diet and exercise, certainly not avoiding tobacco use and alcohol in moderation, as well as just knowing what screenings that you would be eligible for, so you can talk to your healthcare provider about that.
It always comes down to good diet, doesn't it? At the end, diet and exercise is so critical.
Yes.
And then lastly,
Simple but good advice.
Yeah, in the end, what is it that men and women should take away from Breast Cancer Awareness Month?
Yes, I think it's just that screening really does lead to early detection, which can influence outcome and really save lives. So I just want to hit that point home once again, and certainly encourage all your viewers to talk to their healthcare providers about what screening they're eligible for. And as we approach October, mammograms starting at age 40.
Well, Dr. Fernando, thank you so much for joining us, and thank you for watching To Your Health.
The preceding was a paid advertisement.